Pulse thulium laser enucleation of the prostate using Thulio by Dornia MedTech. My name is Ghiraldi. I'm from Philadelphia, Pennsylvania. I specialize in laser enucleation of the prostate. Laser settings used during this procedure were 2000 millijoules and 25 hertz. The technique used for this case was en-bloc early apical release. As you can see here, the first steps of the procedure, just like any case, are to identify your landmarks, the ureteral orifices, getting a good look at the anatomy of the prostate. The first step of the procedure is to identify the borders of the external urinary sphincter relative to the apex of the prostate circumferentially. I always start by marking out a white line circumferentially to achieve this. And I start this white line at the 12 o'clock position. As you can see, the external urinary sphincter tilts in towards the bladder neck in this region. And here I am just marking out my white line. The goal here in the beginning of this is just to, I'm just trying to mark out the white line. I'm not trying to enter the plane yet. I'm just trying to make sure that the borders of the apex of the prostate are well defined. Here I'm just going to repeat that step on the right side of the prostate in a moment. As you can see during this dissection, contact with the tissue is not necessary when using a pulsed thulium laser. I believe this allows for more control during your dissection, less charring of tissue, and easier identification of bleeding when encountered. All this helps achieve excellent hemostasis during the procedure and assists with identifying the capsular plane. Now that the white line is marked out circumferentially, we're going to start deepening that dissection into the white line to identify the capsular plane. Once the plane is entered, in either a top-down or bottom-up approach, you can connect your posterior lateral to anterior plane or go anterior lateral to posterior. This step is repeated on the left side. As you can see, when bleeders are encountered, we can control them easily. Sometimes I'll use blunt dissection in this portion of the procedure, but I do like to rely on the laser energy to enter the plane I feel like it's more gentle on the external urinary sphincter. I also feel like it creates less bleeding during this part of the procedure. So as you can see during this particular case, I'm using very little blunt dissection. I'm almost exclusively relying on the laser energy to enter the plane and perform the dissection. You can see we're doing that right now. We're on the right side of the prostate, coming around the right lateral lobe over towards that anterior plane. Here we are entering the bladder neck. Once the bladder neck is entered, we can now drop each lateral lobe down towards the posterior plane. And that's what we're doing here. We're taking down our bladder neck down towards that lateral plane and making sure the lateral lobe is dropped on this side towards our posterior plane. This step is now repeated on the left side as we separate our bladder neck towards that lateral plane on the left side and then drop the lateral lobe towards the posterior plane. Again, when bleeding vessels are encountered, they're easily controlled with the laser energy. Once both lateral lobes are dropped down from the bladder neck, we just continue our dissection in the posterior plane towards the bladder neck. Here the posterior plane is just being dissected towards the bladder neck until we get up to the bladder neck. And the last step is liberating the prostate adenoma in one piece into the bladder by separating it from the posterior bladder neck. We will spend time on hemostasis if necessary, but as you can see, in this particular case, hemostasis was excellent. Thank you for watching this video demonstrating the Thulio by Dornier MedTech. and block early apical release of the prostate.